Edmonton and Lethbridge are the first cities in Alberta to get Health Canada approval to offer safe injection sites for opioid drugs. Alberta Associate Health Minister Brandy Payne said the decision will help reduce a growing number of fatal drug overdoses and the spread of diseases such as HIV. Evidence shows supervised consumption services save lives, reduce the spread of infectious diseases, reduce drug use in public and reduce the number of needles discarded on streets and public parks, Payne said Wednesday. Listen, a Lethbridge harm reduction agency on news that a safe consumption site has been approved in Lethbridge. Read more. Edmonton accelerates plan to offer safe injection services in inner-city. Payne said the sites will also offer health, counseling and drug treatment services to people who may not have a family physician or live on the street. Health Canada is expected to make a decision about a safe injection site in Calgary by the end of the month. So far this year, Alberta has reported 315 fentanyl-related overdose deaths. There were 586 suspected opioid-related deaths in the province last year. Read more. Fentanyl crisis growing in Alberta prisons, exposing guards. The Canadian Institute for Health Information has said data from Alberta suggests emergency room visits related to heroin and synthetic opioid overdoses spiked almost tenfold in the last 5 years. 4 safe injection sites have been approved for Edmonton, 3 in inner-city neighborhoods and 1 at the Royal Alexandra Hospital. Listen, Tom Vernon chats about safe consumption sites on Calgary Today. Karen Turner, for the group Alberta Addicts Who Educate and Advocate Responsibly, said the safe sites are badly needed. People who are street involved are very vulnerable, and I have personally known many people who have died of unintentional overdose, she said in a statement. It is heartbreaking, and having access to supervised injection services will help. Watch below. Supervised consumption sites have been approved in Edmonton, but their locations are contentious. As Vinesh Pratap reports, some community groups are mobilizing in opposition. Read more. Alberta hopes to set up safe injection site in downtown Calgary. The Lethbridge site will be operated by a community organization in the city's downtown. The southern Alberta city has been dealing with an opioid crisis. Officials have estimated the city has 3,000 drug users and an overdose rate 24% higher than other parts of the province. The region borders the Blood Reserve, where a state of emergency was implemented because of fentanyl deaths. Lethbridge Mayor Chris Spearman said he was grateful for the announcement. I want to thank Health Canada and the province of Alberta for recognizing the urgency of the crisis here in Lethbridge and providing a swift approval of the application. Payne said these sites will open their doors by the end of the year or early in 2018. She said other Alberta communities are considering applying to Health Canada for safe injection sites, including Red Deer, Fort McMurray, Medicine Hat, Grande Prairie and Edson. People who are using drugs are using them every day, and sometimes multiple times a day, Payne said. Having a service close to where they are and close to their community is critical. The first safe consumption sites in Canada were set up in Vancouver. Health Canada has approved other sites in Montreal and Toronto. Last month, Dr. Theresa Tam, Canada's Chief Public Health Officer, said at least 2,816 Canadians died from opioid-related causes in 2016, and that number is expected to grow this year. Deaths involving fentanyl more than doubled in the first 3 months of 2017 compared to the same period in 2016, she said. Copyright 2017 The Canadian Press.